Hey, ladies and gentlemen, welcome to this fantastic brand new episode that we have for you guys today. My name is Ryan Treasure. I'm a digital media expert, been in the space for a number of years, and I want to welcome everybody to the live webinar that we have going on today, all about what doctors want you to know to crush medical debt with Dr. Virgie Bright Ellington. She's an amazing person, and today we're going to have a fantastic webinar with everybody out there, all the panelists, everybody on Facebook that's listening to the live stream, watching it. Welcome to the event. We appreciate you guys taking some time on your Friday to join us right here on the webinar. So, we're going to talk today about, medical debt and medical bills and, how prolific the medical industry is in overcharging and, really just kind of, putting people through the ringer. Medical bills can bury people in debt for the rest of their life. The thing is it doesn't have to be that way. And that's what we're here to discuss with Dr. Ellington. And it doesn't really matter how much you owe. Dr. Ellington says there's a better way to get rid of medical debt beyond just going through bankruptcy, because we all know how bankruptcy really just messes with, everything within your life, makes it really hard for people to get loans for houses. People look at credit for your insurance for a lot of different things. And so we're going to really, take a deep dive today and discuss all of the different things as it relates to medical debt and how you can get out of that medical debt. And so we're also going to be asking some questions. There's going to be a Q&A. Dr. Virgie is going to read from the book. And then right now, what I want to do is I want to introduce Mr. Randall Libero. Randall is the executive producer at Voice America for the radio show. And so he wanted to say just a few things about the radio show and how awesome that's been going, and let you guys know all about that. So Randall, welcome to the webinar. Welcome to the happy hour. I hope all of you guys got something to drink for our toast later on. I don't drink alcohol, so my happy hour is water, but that's okay. You guys do your thing, drink some wine. I know red wine is really good for you, so have a sip of that.
So is red grape
don't
juice.
Have the red wine, right? We're going to go with the juice.
Yes,
but Randall,
yes,
welcome to the show.
Thanks, Ryan. Hi, Dr. Virgie. It's great to see
Randall.
you all. It's great to see everybody on the webinar today. I just want to let everyone know, if you don't know about Dr. Virgie's radio show, check it out. It's on all your favorite mobile apps that you listen to podcasts. It's called Ask a Doctor. Just looks just like that. Look for that show banner. It's also on voiceamerica.com, Voice America Health and Wellness channel. And I figured I'd come on Zoom today. I've got this crazy background behind me, something different for people on Zoom rather than boring backgrounds and things like that. So glad that you're all here today. You're going to hear some amazing information about medical debt that's going to, I think, for most people, be really revolutionary. So stay tuned, stay connected, keep your ear close to your earphones or screen or whatever you're listening on. And don't forget, check out crushmedicaldebt.com, and there'll be lots of updates and things that Dr. Virgie will be putting out in the future. And check out the radio show. Don't forget about Ask a Doctor, what your doctor wants you to know. Find it on your favorite mobile podcast app or voiceamerica.com. Thanks, everybody.
Hey, Randall, thank you so much for joining us. We appreciate your time. You and I have worked together for a long time. This is a passion of ours, working with brands and authors and speakers and, high-level individuals on really getting their message out there. And, that's what we're here to do today. We really want to set the tone for everybody that's viewing this content and, dig into an area where you guys can really start to understand, how to crush that medical debt. And what's crazy is when Dr. Virgie became a cancer patient, she faced like super high medical bills. And, when she took her insider industry knowledge and put it to work in the book, which we're discussing today, which is What Your Doctor Wants You to Know to Crush Medical Debt, she shares secrets and helps individual families and military veterans protect against America's #1 cause of debt and bankruptcy, which is absolutely medical bills. And of course, after practicing for more than 20 years in primary care and psychiatric settings as a health insurance executive, Dr. Virgie, who's a board certified internal medicine physician, medical billing expert, dedicated patient advocate, and former New York One News Health contributor, now helps patients understand complex medical procedures, communicate effectively with their healthcare providers, and of course, avoid financial devastation from crushing medical debts through her What Doctors Want You to Know book series and Ask a Doctor What Your Doctor Wants to Know with Dr. Virgie, which is the weekly show that Randall just talked about. And as I think about it, kind of just internalizing some of the information as it relates to medical debt, I always have this question because this happened to me too. And I always ask myself, do people really look at the itemized versions of their medical bills? Because just a quick story, when my wife and I had our daughter, we had $100,000 medical bill because it was a emergency C-section, all this crazy stuff that happened. It was like a 7-day event for having a child. And so our bills were astronomical. And when I looked at the itemized bill, I was just absolutely surprised because they charged us $700 for a bag of salt water. Like they do the IV and they hook you up. And I'm like, I paid $700 for like a 2-liter bottle of salt water, which was absolutely insane at the time. And, as we're trying to, be excited about our new child, but having that, medical bill in the back of our heads from the hospital, it's just insane. And so, I'm really excited to talk about crushed medical debt because it reveals the tools that people need to stop spending money that you don't owe and save yourself from becoming a victim of the predatory healthcare system. And, I kind of felt that way when I was dealing with that with my wife and I felt like, they were, just gouging prices on certain things. And, I asked about it to the hospital and they're like, oh, well, we got to pay for the salt water and we got to pay for the nurse to install the salt water. And I'm like, it took the nurse like 15 seconds to hang the bag and plug the thing in and walk out of the door, so it's just insane that you spend $700 on something like that. And I'm not by any means putting to the side medical professionals and, what they do, which is very important to, the economy and the health and well-being of the people here in the United States. But at the same time, I guarantee you that nurse didn't get $700. And so, keeping things proportionate would be a lot helpful in this healthcare system that we have. And I want to make sure that you guys know that later on today on the event, we're going to be giving away some Visa gift card prizes for correct answers at the end of the happy hour. She's going to share some medical debt trivia, some different things. We're going to talk about the book. We're also going to have Dr. Virgie read a little bit about the book, share some stories. And then, of course, we have a great interview for you guys to take a look at. And then, of course, make sure you stay tuned to the end as we will pick some 3 winners for $100 gift cards. And then if you guys have questions, comments, or anything, just send that through the comment section and we'll make sure to address whoever is asking the questions or providing a question that you'd like us to answer. So we really appreciate it. And Dr. Virgie, it's your time to shine. Welcome to the virtual happy hour about what your doctor wants you to know to crush medical debt. Welcome, Dr. Virgie. We appreciate your time.
Ryan, thank you so much. I appreciate you. And I know if you're here, if you're hosting and talking to me, it's going to be a lot of fun. So I appreciate it. And thanks to Randall too. It was a very kind introduction. Yeah. So, Ryan, I really wanted to have this virtual happy hour to try to have some fun talking about how to make sure you don't go broke from medical bills. So yeah, I'm going to drop a few facts about debt, for instance, about why most Americans with insurance, with or without insurance, doesn't matter if you have insurance or not, are just one accident or serious illness away from a lifetime of debt and or bankruptcy. And the number one mistake folks in their 20s and 30s make that can destroy their financial future. And then, like you mentioned, Ryan, at the end of the hour, we're going to give away 3 $100 Visa gift cards for the right answers and for maybe asking right questions. So yeah, that's what we're going to be talking about.
Yeah, I really appreciate being on this, just being on the, the receiving end of the medical debt, and being able to share this book with everybody is just an amazing thing. So I'm really hope that you guys really engage with us, send us some messages through the chat, let us know, some instances that you may have questions about in your own life. And then, of course, you can always go to crushmedicaldebt.com at any time after this, contact Dr. Virgie and ask her some questions. She's always there to help out. She's just an amazingly nice human being. And we appreciate all the stuff that she brings to the table. So we want to make sure too that, you guys send us those questions and all that kind of stuff. So we're ready to go. You know, I'm thinking in my head that a lot of Americans with insurance are literally like one accident or serious illness away from a lifetime of debt or bankruptcy. And that's just terrible. You know, even with insurance, you can end up in a particular scenario where you have debt that was, you know, unexpected. So why don't you tell us a little bit, you know, about being an accident or serious illness away from, you know, bankruptcy or debt?
Yep. So Ryan, most Americans with insurance or without insurance is the same number, are just one injury or serious illness away from a lifetime of debt and or bankruptcy, because 80 to 90% of all medical bills have mistakes. So if you think about how many medical bills you've got in your life, if you've gotten 10 medical bills in your life, 8 or 9 of them were wrong. They had errors, right? And if you think about it, do you think they're going to be in your favor? No, they're going to be in the favor of the providers, the medical system, the hospital system, and or the insurance companies.
Yeah, no, you're 100% correct on that. And, you know, I just recently had some issue like that too, where, you know, in favor of the provider, right? I had to have an outpatient surgery in December of 2021. And I went there, you know, my doctor tells me, okay, here's the cost. I asked the hospital provider, you know, how much is this going to cost me? Where am I at with, you know, my payments throughout the year, and how much have I paid in, and have I met my deductible? And, you know, that's why I waited until December to do the surgery, because I'm like, all right, if I wait till the end of the year, you know, I would have reached the majority of my deductible. So my costs will be lower, you know, and they give me an invoice saying, okay, this is what it's going to cost you. And so, you know, I get to the hospital the morning of the surgery, and they're like, okay, we need this payment from you. So then I give them, you know, my debit card to take the money out of my bank account, thinking that, okay, cool, I've paid everything. Everything's good to go. Made the payment. And then about, I don't know, it was like February of 2022, I get a bill. So this is 2.5 months after I already had the procedure. I get a bill for, so what was it, for anesthesia, right? I get a
Yep.
bill from the anesthesia, which the doctor never included in the breakdown, which was
right.
$950 additional dollars
That's
that they
right.
needed to spend. And so I'm like, oh man. So I called my insurance company. I called the place. I'm like, okay, what's going on? And sure enough, they're like, no, you owe us $950. And it was just, you know, so here you are thinking that, you know, you saved up your money all year for a surgery that, you know, that you needed. You know, you asked your doctor, the provider, the hospital, the insurance company, what the total cost is going to be. And then all of a sudden you get another bill, you know? And so that's just absolutely insane, you know? And
So the
so
good news, Ryan,
we-
is that there's the Surprise Billing Act that was enacted and enforced as of January 1st of this year, has a little surprise gift in that not only are surprise medical bills now illegal, and a surprise medical bill is when you have an in-network hospital or facility where you say, okay, I'm going to get my elective procedure done here. And you check to make sure the doctor doing your procedure, the facility is in network with your insurance, but the providers that you have no choice in picking, like the anesthesiologist, does not. And they will generate a bill that's out of network because they do not accept any insurance. And so that's how they get you, right? So that's a surprise medical bill. So that's that's outlawed. Great. But the surprise piece that I was pleasantly surprised to see that they snuck in is that for an elective procedure, any elective treatment care, that the facility has to give you a breakdown of all the costs, including pathology, if you're going to have a biopsy done, or radiology or anesthesiology, the things that you don't have choice over usually. So that is a nice little pleasant surprise. I didn't know that they were going to include when they said they passed this law, that in the future, Ryan, that can't happen to you. They have to give you a breakdown of all expected costs. Yes, if you're going to have surgery, is it reasonable to think that you're only going to have to pay for the surgeon and let's say the OR facility fee? No, you're also going to have to pay for an anesthesiologist. In the past, they did not include that, as you found out in the number. Now, by law, they have to include that for elective procedures.
So when did that go in effect? Because was that a 2022 thing?
Yes, sir. January 1, 2022. You just missed it.
Oh man, Coach Blaylock. But for me, and I think this is an important point, right? As you live your life as a human being, as an adult, and you're working and you're getting compensation for your job and you have all that stuff. When you're first starting out, you get out of college and you're in your early 20s or whatever, and you just first start out, you're kind of very new in the space of being an adult and being part of the economic system, paying your bills and getting a paycheck and all those types of things. I'm 41 years old, and so I've had a lot of time since I was 20 to make sure that I save money and those types of things. And so when I got hit with the $950 bill, it wasn't the hugest issue for me because I had done a good job over my career of making sure that I stashed away some bucks here and there, for emergency situations, kind of like that. Obviously I didn't pay them $950, right, and write them a check. I said, can we settle on, we ended up settling at $600 and then setting up a payment plan for $50 a month until it was paid off.
Excellent.
So that was great. We were able to kind of get that negotiated, but even $600 when you're 20 years old and you haven't had any savings is really difficult. And so I think the number, what is the number one mistake folks in their 20s and 30s make that can destroy their financial future? Because not everybody who's really early on into the workforce is going to have, the savings to be able to do that. So tell us a little bit about that, that mistake that those folks make when they're young.
Yep. The number one mistake people in their 20s and 30s make that can completely destroy their financial future is going without health insurance. So there's actually something called catastrophic insurance that you can get through the ACA or Obamacare through the individual marketplace, but it's only for folks that are age 29 and younger. So if you wanted to say, okay, I'm healthy, I'm young, I work out, I'm a marathoner, I'm not going to need anything, I don't need even any maintenance. It's fine. I'll just sign up for catastrophic coverage. Unfortunately, once you hit 29, you have to get regular non-catastrophic insurance that involves having a monthly premium and, unfortunately, a deductible.
Yeah, deductible. Oh, I hate that word. Deductible.
Yep. That's a big reason why most Americans are just one injury or serious illness away from a lifetime of debt, because there's that statistic that I think we hear a lot about, which is the average American would have a hard time coming up with $400 in case of an emergency. Well, if your annual deductible is $1,000, which is actually not that unusual, it's actually probably in the lower end of average.
Yeah.
Holy cow. If you actually have a serious illness or an accident or an injury or a diagnosis, a serious diagnosis, there you go. You're automatically in debt.
Yeah, I know, like when that happened to me, my deductible was like $2,000 or $3,000 per person, $8,000 per family.
For your family. Yep.
Yeah, because it's, I just have one kid in the house right now. And so, it was and for me, I'm like $8,000 for the family. Like that's a lot of money.
Yep.
Even $3,000 per person is a lot of money.
Think about it. That's per year.
Yeah.
So, God forbid you go in for your scheduled surgery, Ryan, December 31st. The clock starts again when you get out of the hospital. God forbid if you, trip down over the stairs, leaving the hospital, and, you have to, get your leg in a cast or something. The clock starts again. That 8,000 means nothing. You got to start the clock every year over and over again.
Yeah. I think, and that's where I think the whole idea of the predatory health insurance kind of system comes into play, because it's not set up in a manner to be, successful for the patient. It's all set up for the hospitals and insurance companies, to, not put out to put out as little money as possible, and the hospitals to make as much money as possible, putting all the burden back on us, as patients. And, that's just a terrible thing. And, as you think about it, I'm like, why are my copays not part of my deductible? Why are, what I pay additionally on top of the, prescriptions or whatever that my doctor prescribes me that the insurance doesn't cover that I have to pay, why doesn't that not go to my deductible? Because every other component that you pay that's outside of those two things that your insurance doesn't pay goes to your deductible. And
Well, there are some plans have an out-of-pocket maximum, an annual out-of-pocket maximum to cover those issues, but that's high. You're still going bare, for the first $8,000 of care that you need. In the case of your deductible for the family is $8,000. Yep.
yeah, that's just
Same
insane.
thing. Yeah.
All right, Dr. Vergy. Let's kind of shift gears a little bit here and let's talk about, Crush Medical Debt, the book. I want to know a little bit about why, you wrote this book, and then we can move into a little bit of Q&A. We've already got one question that's come in through the Q&A. But, why don't we talk a little bit about why you wrote the book? What was the purpose of, spreading this information, and, what kind of resonated with you, as a board medical certified doctor, that you decided, what, I'm going to release this information to people and let them know, how they can crush their medical debt or how they can avoid that in the first place. Because, a lot of us are kind of clueless when it comes to the ins and outs of that. You look at medical billing and it's just like blows your mind. There's like 7,000 codes for, different things. And then you get your bill and it's like, why is this coded this way? That's not what it was. And then you're on the phone for hours with the doctor or hospital trying to get that corrected, so that way you can resubmit it to insurance. And it's just, it's like putting a carrot in front of your nose and you're just running around in circles.
Yep. Yep. And you know what, you mentioned this a little bit ago, Ryan. The system is just not set up to be in the favor of the American patient. I mean, that's the U.S. healthcare system. That saying, "He who has the gold makes the rules." Well, the U.S. healthcare system is run by for-profit, publicly traded commercial insurance companies, and that's the way it is. So, I've been, you mentioned it earlier in your very nice introduction, I've been a board certified internal medicine physician for more than I want to admit, longer than I want to admit, and, a healthcare insurance executive. But it wasn't until I became a patient when I realized that most Americans don't know how to protect themselves from getting taken advantage of, and basically, frankly, cheated by the U.S. healthcare system. So that's why I wrote Crush Medical Debt. And, when I've been, reading about, stuff that's been out in the media about medical bills and folks getting taken advantage of with their healthcare in terms of paying for their healthcare. There was this statistic that came out last week. The Consumer Financial Protection Bureau, which is the federal agency that was created to help protect American consumers, they put out a statistic last week that in 2021, the number one complaint they got from consumers was being called by debt collectors, collections agencies, demanding payment for medical bills they did not owe. Like the number one complaint by the Consumer Financial Protection Bureau. I mean, that's crazy, specifically medical bills and bills that the patient did not owe. And they get tricked into believing that, and cheated into believing that they owe this money, and just destroys their future, their family's future. And it's just outrageous, and it has to stop. It shouldn't be that way, and it doesn't have to be that way.
Yeah, I totally agree. It's insane that you would have all of this medical debt and getting phone calls from debt collectors. I dealt with that too. Luckily it was only $75. And so I started reading some information and I'm like, I'm not even going to pay that. Because I think that'll drop off right at the end of the calendar year if it's not a certain number, right?
Yeah, so that was one of the things that was really nice about earlier this month. There is a law now that the 3 credit insurance agencies have to, instead of waiting 6 months before they can post a past due or collect overdue or report a medical debt to collections, instead of 6 months, they have to wait 12 months. And the other thing that's really great is that now you have to have the credit agencies have to drop off reporting any medical bill or debt that was in collections that actually got paid off. So in the past, it was treated like any other debt, consumer debt, credit card debt, in that even if you paid it off, if once it gets reported to your to collections, it stays on your credit for 7 years. Well, what's really nice is now that drops off, and that goes into effect July 1.
Ah, wonderful. That's great to hear that goes into effect, because it's definitely affecting a lot of people.
Yeah.
And when you talk about medical debt, I want to spin this in a positive manner, because there's a lot of folks that are out there that are trying to help individuals with their medical debt. And I want to mention a great nonprofit that you've teamed up with, which is RIP Medical Debt. The folks over there, they're former debt collectors, and they're like, what are we doing? We're bothering everybody. We're driving everybody crazy. And so they took a complete 180, turned that around, and now they buy medical debt. Instead of calling people and hounding them about paying medical debt, they've created a 501c3 nonprofit, RIP Medical Debt, where they actually buy medical debt. So for every $1 that they receive, they're able to buy $100 of debt to help people get out of medical debt and help them get back on track with their credit. As we alluded to earlier, when your credit score is low or impacted by, medical debt, then it makes it really hard for you to get your mortgages and those types of things that we talked about earlier. We don't want that impact. So a portion of the proceeds from the book are going to go to them, which will have an immediate impact on helping folks stuck in predatory healthcare system. So it's amazing.
Yep. It's really exciting. It's really
So
exciting.
how did you team up with RIP Medical Debt?
So in the process of, researching the issues with people getting cheated by the healthcare system in terms of, financial, essentially just being taken advantage of financially, that just destroys lives. And, like I said, I've been a physician for many years, healthcare insurance executive, but it wasn't until I became a patient and I had to have emergency surgery. And my hospital roommate was this sweet young mom. Her husband was a hardworking guy. Frankly, he worked at a 24-hour diner. So, he's not making a lot of money. And, they had 2 young preschool aged children. So that, she wasn't able to work outside the home and their resources were limited. And I found out in our conversations that she had been taken advantage of by the hospital billing department. And they said, look, before you leave, you need to sign for this bill. This is how much your care is going to be that you had while you were here. This is what you need to sign an agreement to pay before you leave. And I'll tell you, Ryan, I saw red, the curtain dropped, and I was enraged because I knew that without even knowing the details, that this person and her family have essentially signed away their financial future. They're just going to be in debt for eternity. And, I thought, you know what, Virgie, don't get angry, get to getting, do something. And that's how Crush Medical Debt was born. So yeah, in the research, I found out some good stuff that RIP Medical Debt was doing. And, the fact that they paid off more than $6 billion with a B, billion of medical debt for folks that are facing bankruptcy if it hadn't been bought by this charity. That's a huge deal. So for every dollar that gets donated to RIP Medical Debt, they they buy $100, pay off $100 of debt that's in collections for people that are under a certain income ratio to the amount that they owe, their income in relationship to the amount that they owe.
Yeah, no, that's just an amazing service. And, kudos to RIP Medical Debt for, making that 180 turn from, bugging people about their medical debt to actually buying up the medical debt and helping people out. It's just a fantastic nonprofit. As we move in through our happy hour here, we're about halfway through our event today. So again, thank everybody for being on today and taking some of your Friday to hang out with us and learn about medical debt. We want to make sure to get this information out there so people can be renewed in their sense of ability to get out of the debt that they have. And, obviously you have the RIP medical debt folks that are out there helping, and, we really appreciate them for what they're doing. I want to shift gears just a little bit, and I want to share some excerpts with the folks that are on from the book, What Doctors Want You to Know About Crushing Medical Debt. So, Dr. Vergy, can you read a couple of stories from the book that resonate with, kind of what you're talking about? I think that would be, really helpful, kind of giving people a sneak peek of what's in the book as it comes out on March 19th for, you to purchase.
May 19th.
May 19th.
Yeah.
Hey, I got it right. I started with an M.
Exactly.
Yeah, May 19th.
Close, very close. Yeah, I'd love to. Let me pick a couple of stories here. And the book is actually a collection of stories. So I'll pick out a couple, and it gives us an idea of, great descriptions, I think, of what happens to the average American patient in the US healthcare system. So I'll start with Matthew's story. So I saw this story about Matthew, who has private medical insurance through his job as an essential worker at a senior living facility in Kaiser Health News, or KHN, which is an online newsletter that features people struggling with medical bills. Matthew was 25 years old when he passed out at work. He was diagnosed with viral cardiomyopathy, which is a type of heart failure complication from the flu. Although Matthew had insurance, he couldn't pay what he owed the hospital. The hospital sued him, and Matthew ended up filing for bankruptcy before his 30th birthday. As Matthew told KHN, quote, "The curse of being sick in America is a lifetime of debt. The biggest crime you can commit in America is being sick," unquote. He said he, quote, "always made sure to take jobs with health insurance, so I thought I'd be all right," unquote. But like nearly half of Americans under age 65 with private insurance, Matthew has a high deductible health plan with a yearly out-of-pocket maximum that's unaffordable if he has the misfortune of having a serious medical problem. 2 years after Matthew declared bankruptcy, he was told he needed a cardiac ablation, which is a procedure to fix complications from the cardiomyopathy. Because the ablation was elective, meaning not an emergency, Matthew met with the hospital's representatives ahead of the scheduled procedure to set up a payment plan for the anticipated $7,000 cost, which is more than a quarter of his annual salary. Matthew is beginning to realize the $500 a month payment he agreed to is still beyond his means. And he admits he's facing another bankruptcy. Moral of the story: Americans are sick, tired, confused, overwhelmed, overcharged, and undercovered by our healthcare system, and one serious medical illness or injury from financial catastrophe. I can read another story. And I touched on Mia's story a little bit a while ago, a few minutes ago. We were talking about what made me write the book. And my hospital roommate was Mia, and this is Mia's story. Mia is a 34-year-old mother of 2 young children who was my hospital roommate when I had emergency hernia repair surgery. Her husband works tons of days and hours at a 24-hour diner while she takes care of their preschool-aged girls. Mia was a lot of fun. She would pretend to get electrocuted from the automated vital signs machine her nurse connected her to and tell funny stories just to make me laugh. During our conversations, Mia shared that this was the second time She'd been admitted in the past year for concerns she might have a stroke. I felt badly for this young, sweet mom who must be scared about her health, but I became more upset when she told me the details about paying for her first hospital stay. As she was being discharged, a hospital representative came to her room, presented her with a bill for the admission, and demanded Mia sign an agreement that forced her to accept a payment plan that almost amounted to as much as her husband brings home in an entire year. I explained to Mia that the most important rule when you get treated at an emergency department or hospital is to never agree to a payment plan on arrival or at any point in your stay. Moral of the story, never sign a financial agreement or payment plan before you get the actual bill for an emergency room or hospital visit. As I asked Mia, how can we agree to pay for services if we don't know how much and for what we're being charged? We don't receive itemized bills and the opportunity to review them for accuracy until after we get home from an ER or hospital. So you should never agree to a payment plan during the registration or discharge process.
Wow. Yeah, that's 100% correct. I mean, especially like, you know, when you go to the hospital and you're getting ready to go through an elective surgery or whatever the case may be, you're already nervous, right, about what's going on, you know, the procedure that's happening, and it's a really bad time to make any kind of financial decisions because your mind is not in a space to really absorb the information that's being thrown at you, because you're like, oh, in 15 minutes I'm gonna be asleep on the table. Or whatever the case may be with whatever's going on. You know, if it's an OR, it's even like an emergency room situation. It's even crazier, right? Because you're getting rushed to the hospital, you know, and whatever your ailment might be, and they're, you know, a billing person comes in and they're like, hey, you want to pay some money? And you're like, I just came in an ambulance and you're asking me about, you know, like billing, you know, get out of my room
here.
Yeah, get out of my room. Let me not let me deal with my medical issue first.
Well, you're scared, you're in pain, you're not aware. What if I rolled into this hospital visit where I met the person who made me write the book, who brought me to crush medical debt. I rolled in and I was septic, which is meaning bacteria was getting to my bloodstream. And that's how people go out. You're not perfusing your brain, so you're not thinking clearly. And so, yeah, you're not thinking clearly and or in pain and or scared or all of the above, right? Okay, yeah, you're going to put something in my face and you're afraid. And so we're all going to think, well, what if I don't sign it? Maybe they won't treat me.
Yeah.
So that's how they get you. Now, there is something, I do want to share this. There is a statute, apparently in a legal statute, such that if you were forced to sign a contract under duress, it can be considered null and void. And so signing a financial agreement to pay when you're in an emergency room, I would think that's under duress. That's something I think you should discuss with a lawyer.
Yeah, no, I'm not a lawyer. I just play one on television. But yeah, no, that's 100%. I've actually gotten out of agreements because I wasn't forced, but I was in a hostile environment.
You were under duress.
I did. I got some stuff dismissed, a legal document, because I was under duress.
That's right.
Yeah, you're 100% correct when you talk about being under duress.
Just because they're not pointing a gun to your head, that doesn't mean you're not under duress. There are certain things that you're clearly under duress. Yeah.
Especially when you're in a boardroom and it's 8 against 1.
Yeah.
That's duress.
Yeah.
So, hey, we got some great questions that are coming in, and I know this is our time where we wanted to move into a bit of Q&A before we get into the interview that Jack Canfield did with you. We'll do that after the Q&A,
Okay.
But we have some questions that have come in, so we want to address some of those. And then remember, some of these questions that you're asking will also be some stuff that we'll discuss at the end of the show for the $100 Visa gift card giveaways. We're going to give away 3 of them. So Dr. Virgie is putting her money where her mouth is, giving away $300 to 3 folks, $100 Visa gift cards who answer or ask great questions. So let's move into that a little bit. I think the first question that we got actually was from an anonymous attendee saying, can a medical debt be charged off somehow?
Well, yeah, particularly if there's a couple of things. First, most medical centers and hospitals are actually tax exempt, or what we call nonprofit. In this process of writing Crush Medical Debt, I don't call nonprofit medical centers nonprofit anymore. I call them tax exempt. Anyway, because to be tax exempt, the requirement is, in exchange for that, the federal government says that you're going to provide care that's worth at least as much as you get in a discount from paying taxes to the community for folks that can't afford to pay for their care. So what you can do is, if it's a nonprofit, by federal regulations, they need to provide charity care. It's called different things: charity care, financial assistance, or financial aid. And just because you think you have a really high income doesn't necessarily mean you don't qualify. If you have a really, really big bill, like $100,000 bill, maybe even just a $10,000 bill with an income, you'd be surprised that you get a portion of it written off. What do you call that? What's the word I'm looking for? Where you get a related to your income. You know what I'm saying?
Like a tax credit?
Not a tax credit. Why am I blanking on this? But so according to a sliding scale. Thank you, Irene. A sliding scale. Thank you, Dr. Dina. Sliding scale according to your income. So yeah, so if you don't ask, you won't get any relief. So you have to ask, and particularly a nonprofit or tax exempt institution. But you know what? Even for-profit centers have, financial assistance programs. So, please ask.
Yeah, no, thanks for that information. And speaking of Dr. Dina, earlier on, she said it's poor integrity to not pay bills that are indeed owed, as it is wrong to bill incorrectly.
That's
so
right.
thank you for that statement, Dr. Dina. That's 100% correct. I mean, I walk into the hospital or the doctor's appointment, I know that I'm going to owe some money, right? I mean, I know that these services cost money. It's just unfortunate that we get billed incorrectly. I'm going to pay, but only if I get billed correctly.
Yeah.
So we have another question from Bruce. He said, I get EOBs and can't make heads or tails of them. How do I know I'm being charged correctly?
So an EOB stands for explanation of benefits. And an explanation of benefits is what your insurance, if you have insurance, it's what you're sent by the insurance to let you know that your provider sent them a bill for paying for your service. And so the EOB, if you look at the back or the front page, is usually a summary and of the total amount that they paid or they decided not to pay. And then the subsequent sheets are a breakdown of what was submitted by the providers. And so the EOBs will break out what they paid, and sometimes they don't pay what you would hope. And then they go into, is it in network, out of network, and they'll have little like a number saying, okay, look at the bottom under number 1, this was denied, or we didn't pay all of it because it was considered out of network. So that's the first thing. They'll tell you what they paid and or if they didn't, why. The second thing you want to think about when you're looking at your EOBs is, if you don't understand it, there's a number on the back of the, usually it's actually on the front, but sometimes in the back pages, call that number and they'll explain it to you. You call the representative and you can say, look, I don't understand what's going on here. Just call and ask the question.
Yeah, good information on that. And I agree that I spent so much time on the phone, asking questions of providers and different things when we had our daughter. Fortunately, we did get it all resolved, and there were some steps that the hospital took to help us out, but I still ended up having 2 years of payments. Funny thing is too, like, I'm on the phone with the billing, and you guys, I hope this is funny. Please don't take this the wrong way.
Uh-oh.
billing person's on the phone with me, and I'm going through this, and she's telling me all the stuff, and I have my explanation of benefits from the insurance company in front of me. And I asked the lady, I said, this is a lot of money. She goes, yeah, I understand. Unfortunately, you had some, some emergency stuff that happened, which caused the bill to go up and all that. And I'm like, can I just bring my kid back? Like, I'll just bring her back. And then you guys, and the lady
Can I
on the
return
phone,
it?
yeah, she was like, so you could hear her on the phone. She was like, she's all angry because I said that, thinking like I'm going to be a bad dad or whatever. But I don't know.
Do you
If we
guys
can't
take
joke around a little
returns?
bit in life and have fun with stuff, what's the point, right? And so it was just a kind of a funny story that I asked the hospital to take the kid back.
That is
Obviously, I was
awesome. That's
joking.
funny.
I love my daughter. She's amazing.
Yes, sure.
So we got
Yeah,
another
Brian,
question from
yeah, we believe you.
Darla. Darla says, "What can I do when I receive a bill for a COVID vaccine?"
So there's a couple of things with COVID. So at the very beginning of the pandemic in March